And on Radio 2, well, let's discuss these issues on social care in particular and talk to Dr. Jon Stanley, who's a health research fellow at the centre-right think tank, the Bow Group, who joins us from our studio in Edinburgh. Thanks very much for being with us. What do you make of the Conservatives' policies on social care? Everyone knows this is an area of policy that needs to be addressed. All the parties recognise that, but this is the Conservative Party's answer.
Well, I think, given that it's such an important area, it's quite disappointing that we seem to have gone at least 7 years back, if not further. You know, we had a report out by Dilnot that was meant to give reassurance against catastrophic care costs. It was meant to value home ownership, and it was meant to restore an intergenerational contract. But what we see at the moment is a continuation of this idea that you either pay everything or you pay nothing at all. And all that's really happened is they've increased the amount you're allowed to keep, if you like, from 23 to £100,000. But there's no taper on that at all. If you have very high care needs, if you've had a very dense stroke, for example, and you have an asset base of maybe £300,000, you can burn your way all the way down to £100,000 in less than 4 years. So what we would like to see in the Bow Group, what we've discussed in the past, is that there should be a cap on cost, but it shouldn't be by asset base. It should be by capping all costs after 5 years, making sure the nursing component is provided by the NHS. And you know, I just think that given the pace of the election campaign, that this could have had an awful lot more attention paid to it when a huge amount of work was done by David Cameron, by George Osborne, and by the Liberal Democrats when they were in coalition. We seem to have thrown the whole lot in the bin, and there doesn't seem to be much of a plan to replace it.
But your concept of a cap, which is one of the alternative suggestions, could the country actually afford that sort of system?
Yes, it could, because when we looked at the data, the whole point of a 5-year cap is that actually very few people ever need to get beyond 5 years in long-term care. But if they do, they can end up being there for many years, maybe as long as 10 years. And so for a very small cost, which will only in the end cover a small number of people, you end up giving everyone that peace of mind that they're protected against those catastrophic care costs. That, you know, in some cases it might be up to £500,000.
I mean, the Conservative manifesto and the Conservative Party and the Prime Minister saying they are providing more peace of mind for people because they're saying you will be able to pass on to your children at least £100,000. That is ring-fenced.
Yeah, but the whole point about conservatism is you have capitalism and you have family together. Now, there's nothing wrong with succeeding in life, you know. And in the home counties, for example, if you pass on £100,000 to maybe 2 children, that's not even going to cover a deposit for a quite basic house. Whereas in the past, families worked hard, they strived, and they put money away so they could invest in their families so that each generation improved. It's that intergenerational capitalism that really is the core of conservatism. We seem to have missed that here.
Very interesting to talk to you. Thanks for your time. Dr. Jon Stanley, the Health Research Fellow.